In this video, I'll uncover the best strategies for weight loss over 50 to make sure that you're not only thinking about the different activities that you do when you go to the gym, but also the activities that you can just do recreationally. The risk of heart disease, the risk of diabetes, the risk of cancer, this drastically increases after you hit 50 years old. Sleep starts to get bad in your 30s, and then it gets worse in your 40s, and then 50s, things really hit the fan. And so we want to make sure that we're constantly working to improve our sleep. Weight loss is one of the many things that people struggle with as they start to age. It's estimated between 70 and 80% of people who are 50 years and older are struggling to lose weight or wish they could cut some of the fat off their body. How do I know this? Because this is the main age group and demographic that I work with clinically every single day. And so what I want to do in this video is I want to share the same tips that I give to them with you. And that's why in this video, we're going to discuss tips for weight loss over 50. We'll talk about, first of all, why does weight loss slow down as we age? Then we'll talk about the main strategies that you must implement in order to get great results with weight loss as you age. And if you're not 50 yet, let me tell you, time flies. So make sure you stick around for this video so you have these strategies in your back pocket and you know what to do when it comes to weight loss as you age. But before we get started with this video, I'm Dr. Zyrowski and welcome to the channel. If you're new to the channel, it's a pleasure to have you here. Be sure to subscribe, hit that bell notification, and join our notification community. And that way I can help you excel your health and your life. What I want to do first is talk about why. Why is it harder to lose weight as we age? There's a lot of changes that are occurring in the body. So let's go ahead and talk about these changes. First of all, our metabolism just isn't nearly as efficient. When we're in our 20s and our 30s, our metabolism is still more efficient. Even as a, teenager, remember how efficient your metabolism was then? You could eat anything, right? And then, like I said, it slowed down a little bit in your 20s, slowed down a little bit in your 30s. And then of course, once you hit your 50s, it seems like it comes to a screeching halt for many people. So one of the things that we want to do is we want to work on making our metabolism more efficient. And I'm going to give you strategies to do that in just a moment. There's a lot of hormonal changes that starts to occur. If you're a female, you're going to have a decrease in estrogen. If you're a male, you're going to have a decrease in testosterone. And either gender is going to have a decrease in growth hormone, which is a major issue when it comes to weight loss. So we'll of course talk about how to boost those hormones up as well. Now, the other thing that happens is you're going to start losing muscle mass, right? When you start losing muscle mass, you are burning less calories on a daily basis. And, this is just a struggle. So we'll talk about how to improve muscle mass. And then next thing here is more stress. There's a lot more mental stress associated with hitting, these particular age groups. And the reason for it is because there's a lot of changes going on. Maybe you're thinking about retirement. You're thinking about, finances. You're thinking about, just that midlife stuff. And so a lot of stress going on for many people. Less sleep is another major issue. It's estimated that, people start having sleep problems in their 30s, and every 10 years it gets worse, especially when you're hitting about 50 years old. This is when people really start realizing that they're struggling with their sleep and they need to make changes because they're desperate at this point. And let me tell you, this really affects how you're going to be able to lose weight, which we'll talk about shortly. And then of course, less activity as well. A lot of people, at this point in their life are just getting way less activity than they used to. And so it's important to make sure that we're getting proper movement daily. And I'll teach you how to do that as well. So let's go ahead and first talk about the little things that you can do. I'm a big fan of adding in the little things that add up, okay? Now, there's all these different strategies out there. And let me tell you, there's not one single one of them that's going to move the needle 100%. But when you start stacking up all these different strategies in your favor for weight loss, you start to get some really good results. Let's go ahead and talk about apple cider vinegar. And these are just the little things, right? Most people have apple cider vinegar in their home. It's something that you can use in order to help keep your blood sugar balanced, to help keep your blood sugar low. It's something that you can utilize before meals. And there's tons of different science out there that is going to really prove to us that, this is going to help with weight loss. Okay, so what you can do is you can mix up an apple cider vinegar drink. You can go in and do a shot of apple cider vinegar in the morning, however you like to use apple cider vinegar. But the fact is that it helps with weight loss. It helps with balancing our pH. It has the acetic acid in it. It's good for our gut health, and it supports weight loss, as I mentioned. So adding in some apple cider vinegar before a meal or when you're waking up first thing in the morning, it's a really good thing for your overall health and supports weight loss. MCTs is another thing. This is a little thing, right? This is a little thing, but hey, they add up. And so one of the things I always like to do is I add MCTs to my coffee every single day. You add these MCTs in, they're good for your brain health, but they also are research proven to support burning more fat and weight loss. And so one of the things you can do is put these MCTs in your tea, your coffee, whatever it is you're having in the morning, your smoothie, and it's going to help burn fat and of course give your brain some good energy. I'll put a link in the description below to the MCTs that I use. I like using a powder that is actually patented and research proven to help you burn some fat off. Intermittent fasting is another strategy that you can use, okay? Very simple. I have people utilize this in my clinic all the time. I have, a patient who recently came in and was just really struggling to lose weight. And one of the things that I did is I started pushing him to utilize intermittent fasting. And let me tell you, when you're 50 years old, these habits are really hard to implement, these new habits, and breaking the old habits are pretty hard to break. So, one of the things that I found that this particular individual was struggling with is actually, skipping his morning breakfast. He's had, some sort of bagel or pastry for breakfast every morning for the past 50 years. And so breaking that habit was very difficult, but intermittent fasting is a very simple strategy. Basically skip breakfast and then start your first meal at lunchtime. It's a very simple strategy to implement in order to start burning more fat. And let me tell you, when you implement intermittent fasting, it's going to help boost up your growth hormone, boost up your testosterone, boost up your estrogen levels, and really help you get better hormones that are going to help you burn fat. And then of course, when you're intermittent fasting, you start burning fat for energy if you're getting into the state of ketosis during this time as well. So it's so powerful for weight loss, and it's just such a simple strategy. I personally use this every day in my life. And to be honest, if I was 50 years old, I couldn't imagine not utilizing this because it's just too easy to use to, put off to the side and avoid implementing. So add some intermittent fasting in. And by the way, I'm going to talk about a lot of different things here in this video. I will put links in the description below. So if you see this intermittent fasting, you're not real familiar with it, there'll be a link to a video below. Fasted exercise is another thing that you can utilize in order to help boost up a lot of these good hormones. Okay, so not only do you intermittent fast, so you skip breakfast, but then while you're in that fasted state, you exercise. And essentially what that's going to help do is just skyrocket your growth hormone. It's going to skyrocket your testosterone. It's going to really help get those hormones boosted up. Okay, I mean, there's some estimates of boosting growth hormone upwards of 2,000% in males and 1,500% in females when they're doing fasted exercise. So anyway, fasted exercise is really powerful for, growth, recovery, repair, and also going and getting a lot of great benefit of weight loss as well. Now let's talk about exercise over 50, because this is something that a lot of people start to get a little bit confused on, and they're thinking, I'm 50 years old, right? And depending on what kind of 50-year-old you are, it really depends on how you approach exercise. If you've exercised your whole life, you approach it a little bit differently than somebody who maybe has never exercised their whole life, but is understanding at this point, the average age that people get things like type 2 diabetes is 45 years old, and you better start doing something. Otherwise, there's going to be some, big consequences. And so one of the things that you need to do, first of all, is you need to do some weightlifting. I'm not talking about going to the gym, becoming a bodybuilder. If that's something you want to do, maybe that's a great thing for you at this point, but go and do some weightlifting. Make sure that you're lifting weights. It's important for not only building muscle, which is going to help you burn more calories throughout the day, but it also is very important to protect your bones so that you can protect your bones from osteoporosis. Basically, when you start lifting weights, it's going to help increase bone density, but it also is going to help increase muscle mass, which is very important as you age, because remember, you start losing muscle mass as you age. So you want to actually work on increasing it. So very important there. So do some weightlifting. Now, high intensity interval training is also really good. Now, if you're not familiar with this, like I said, link below. High intensity interval training is basically where you're going to go and just do a form of exercise for a short duration at a high intensity. A simple example of this might be doing sprints for, 20 minutes, 30 seconds on, 30 seconds off. Now, of course, the intensity is based on you. A well-trained athlete is going to be doing a much higher intensity than somebody who has never worked out a day in their life. And so for a well-trained athlete, it may be sprints for 30 seconds on, 30 seconds off. But for someone who has never worked out a day in their life, it may be just a fast-paced brisk walk, okay? So make sure that you're doing some high-intensity interval training, and specifically this because it really helps with weight loss, but it also is really good for people who have insulin resistance. Like I said, average age that people are getting this, 45 years old, and it's a huge epidemic today, okay? There's people even in their 20s and 30s who are getting this issue. So I want to make sure that if you're 50, you are really fighting to reverse this issue if you have it, but of course avoid it and prevent it as well. High intensity interval training is really great. Now, here's the other thing that you can do, okay? Because a lot of people think that, the only form of exercise is going to come in going to the gym and grinding it out. However, exercise comes in the form of recreation as well, okay? So going for walks with your family. Yoga is a really great form of exercise too. Many people become very rigid and tight and stiff, uncomfortable, pain all the time from a musculoskeletal perspective when they start to hit their 50s and 60s. So we want to make sure that you're doing things like yoga to help keep your muscles stretched out, keep your joints limber. Very, very, very beneficial at this point. Biking, also swimming is a really great activity as well. So make sure that you're not only thinking about the different activities that you do when you go to the gym, but also the activities that you can just do recreationally. I have so many people I take care of who are in their 50s or older, and they go on a regular basis biking on trails and they really enjoy it. Next thing is dietary changes that you need to make over 50. Okay, this is when things become very sensitive, right? This is, eating junk food doesn't just throw you off a little bit, it throws you off a lot. So we have to really, get a little bit refined here, fine tune our diet. First of all, low carb eating is going to be very important. I recommend 100 grams of carbohydrates or less per day. Okay, start measuring those carbs. And these carbs that you are eating, I want you to make sure that you're focusing on good, healthy carbs. Okay, not eating things like pasta and white bread and all these really low quality carbohydrates. I want you to focus on eating high quality, real food-based carbohydrates, sweet potato, beans, those kinds of things. Now, we want to make sure that we're, first of all, doing the low carb, but like I said, we want to also focus on whole foods, get rid of the processed foods, the packaged foods, all this stuff. I mean, let me tell you, the risk of heart disease, the risk of diabetes, the risk of cancer, this drastically increases after you hit 50 years old. You want to make sure that you're doing the right things to avoid these issues. Many people are just ridden with inflammation at 50 years old. We want to make sure that we're doing things to reduce inflammation. Eating a healthy diet is critical for that. And then, of course, making sure that we're eating high fat, okay? All these different high fat foods. Eggs is an example of a high fat food. Avocados are an example of a high fat food. Olive oil. I want to make sure that we're including lots of good fats in, because research has proven time and time again that people who eat more good quality high fats, they feel more satiated, they eat fewer calories throughout the day. Therefore, as a result, it helps them lose weight. And then of course, moderate protein is very important to get our protein in, but we don't want to have an overabundance of protein. So just a good moderate protein in your diet. Let's go ahead and talk about sleep over 50. This is a major issue as well. It's estimated, as many of these things are, that, sleep starts to get bad in your 30s, and then it gets worse in your 40s, and then, 50s, things really hit the fan. And so we want to make sure that we're constantly working to improve our sleep. And there's good reasoning for it. First of all, what happens if you get a lack of sleep on a daily basis, you start to have a decrease in leptin. Leptin is this hormone basically that tells your body you're full, okay? So if you're having a decrease in this hormone leptin, as a result, you start to want to eat more, and it causes a lot more cravings. Then you have an increase in ghrelin. Ghrelin is the hormone that actually tells your body that you're hungry, okay? So you imagine you're not getting enough sleep, you're trying to lose weight, and then of course you can't tell when you're full, but yet you're hungry all the time, and it's all a result of just not getting enough sleep. Unbelievable, right? So this is why it's so important. And also when you get a lack of sleep, it's linked to impulsive eating, okay? So we have to make sure that we're constantly working to get better quality sleep. So what I recommend is that you track your sleep. It's very important. I've been tracking my sleep for almost 5 to 10 years now, and it's something that is really interesting to do, because you can basically set up your own little sleep lab. Do I get better quality sleep if I go to bed earlier? Do I get better quality sleep if the room's colder? Do I get better quality of sleep if I have white noise on? Do I get better quality of sleep if I don't watch TV at night? If you're able to actually track your sleep, you can create your own little sleep protocols and really focus on improving not only your quality of sleep, but also the number of hours that you're sleeping at night as well. So put in the comment section below and give this video a thumbs up. And here's the next thing that I want you to do. I want you to watch this video over here that's going to help you choose proper breakfast foods. Most people are eating breakfast foods. Make sure that you're eating the right ones. This video teaches you how. Watch this. If you eat a high carb breakfast, high sugar breakfast, you basically consume way more calories throughout the entire day.